Hello and welcome to this video. My name is Kris, I'm an Australian GP. And do you feel like you always have to pee? Are you getting up several times a night to empty your bladder? When you've got to go, do you feel like you've got to go? These are common signs and symptoms of something called having an overactive bladder. Please note, these are also common signs and symptoms of a variety of things, from diabetes to pregnancy to infection and bowel issues and more. So if you've got any of these symptoms, don't just go, oh, I must have overactive bladder. But this is an educational video about overactive bladder and what it is, how we treat it, how we find out about it, and more. So if you're interested, please keep on watching. And if you're new or haven't been here for a little while, I'm still getting used to wearing my glasses in my videos. I've worn glasses for over 10 years, but I quite often will catch myself and duck because I don't like having the ring light in there. But I typically will not wear my glasses, and because I've got my notes on my computer next to me, will squint and then come back, and it was just getting a lot in editing. So I'm like, you know what? Wear your glasses, wear them with pride, you're myopic, it's fine. So anyway, carrying on, overactive bladder. So, of course, when we talk about overactive bladder, as the name suggests, your bladder is overactive. It usually contracts more, it feels quicker, or at least it feels like it feels quicker. And so when you've got to go, you've got to go. You feel like you're going a lot. This is commonly coupled with symptoms of incontinence. That is, losing urine when you don't intend to urinate. This is a little bit different to stress incontinence, which is where typically in those born in female bodies, and typically those who have had children or pelvic trauma, or who are going through the menopause or are older, so above the ages of 50s and 60s, where if you sneeze, cough, jump, laugh, or increase your abdominal pressure at all and push down on your pelvis, you will lose urine, so leakage of urine. This is slightly different, but often it can be coupled together as well. So I just said a lot of words at once. Long story short, you can feel like you've got to go a lot, you can go a lot, and sometimes you can lose urine as well without intending to, and that can all be because of having an overactive bladder. And let's talk about it. Let's talk about how annoying that is. Let's talk about the fact that you need to go all the time. People who suffer with this often have to know where the toilets are and will go out of their way to avoid places where they know they won't be able to get to a toilet for a long time. If you are incontinent and losing urine, a lot of people find this, if not all people find this, mortifying, embarrassing. People will wear liners, people will sometimes wear nappies. It's debilitating on not only a physical level, but also a social and a psychological level. So it's really important that we destigmatize and talk about these things and talk about how we can get help. So a frustrating part of overactive bladder syndrome, or having an overactive bladder, is that it's not a diagnosis we make with a blood test or a scan or a history. It's actually what we know as a diagnosis of exclusion. That is, we make this diagnosis once we know confidently it's not because of anything else. That being said, it would be negligent if your doctor didn't rule out other causes, including but especially malignancies or other muscular conditions of the pelvic floor, before just saying you've got an overactive bladder, go and do X, Y, Z. That would be really negligent of us. So I hope that anyone who sees this, believes they have overactive bladder and goes to their GP, understands it won't just be, yes, you've got it, here go. Or if it is, hopefully there's a lot of reasons why other things are happily excluded. So what can we do to rule out other things? In terms of infection, a urine test is really the best and the easiest way to rule out a bladder infection. Urine can also be used to rule out STIs, which can, technically infections, and can also cause some urinary symptoms. We also can look at the urine to make sure that there's no signs that the kidneys are damaged in a way that they are leaking proteins or sugars because of diseases like diabetes. The urine tells us a lot. Other things we can do include ultrasounding the bladder, the ureters, and the kidneys. The ureters, of course, being the connection between the kidneys and the bladder. to make sure there's not an anatomical or a physical reason that you feel like you're going all the time. If these two things aren't convincing, there's no cause found, we're not quite sure what's going on, you may be then referred to a pelvic physio and or a urologist or urogynecologist to assess your pelvic floor, see if it's muscular, maybe look at urodynamics. How quickly does your bladder fill? How quickly can you empty it? Do you get good stream? Go through all of that to figure out what's going on. So it can be quite a comprehensive and extensive work. Finally, if all else fails, we can actually do something called cystoscopy, which is putting a camera in through the urethra, which is usually the exit port of the urine, so it's not always comfortable, and look inside the bladder, figure out what's going on in the inside, because scans can only pick up so much. So let's say we've ruled out everything else and you have been diagnosed with overactive bladder syndrome. What can you do? There's really three main ways we can approach this. There's the conservative approach, which is telling you about it and modifying risk factors, making sure that your fluid is managed, you're not drinking too much or too little or too much at one time, reducing things like caffeine that can really irritate the bladder, reducing and avoiding constipation, which then can also really irritate the bladder, and training your bladder, strengthening it, or at least training it not to feel full at a certain point. Because quite often what happens is your bladder starts here, it has the capacity to get to here. This is grossly just not to scale. So it starts here, it can get to here, but when you get to here, that's when it feels like it's full, when you can actually get to here. The second thing we can do is use medications or pharmacological management to help reduce the signals of filling or to help relax certain muscles or whatever the main cause is, so that you don't feel like you've got to go and you got to go. Obviously you want to feel like you want to urinate. What I mean is, like, when you have to go, you have to go. Reducing that, reducing the frequency, and just making it less irritating. Thirdly is the more invasive therapies. There's the minimally invasive therapies like Botox. Then there's the more invasive therapies like surgeries. So there is a lot that we can do for overactive bladder and the symptoms that it brings, because it's not just about needing the toilet all the time. It's the social side of things, it's the quality of life, it's the psychological. It's not a condition to just go, meh, I have to pee all the time. There are things we can do about it if it's really affecting you. So there you go, guys, a little bit about overactive bladder. If you've got any questions, of course, let me know. If you've got any requests for a next video, let me know down below. Don't forget to like and subscribe if you haven't already. And until the next video, I hope you stay safe, stay healthy, and I'll see you in that video very soon. Bye.